If you've ever felt like credentialing is this black hole, it takes your time, money, and just mental power, then you are certainly not alone. So obviously, we are a full-service medical billing company, and we work with practices every week that are growing, that are, trying to figure out how to make the most of their time and energy, but are oftentimes frustrated with credentialing systems. So most of these issues are avoidable. So we are going to talk through the top 5 credentialing mistakes we've seen practices make, and starting from just those that are annoying and expensive to those ones that you can completely control. So by the end of this, you're going to walk away with knowing how to spot those risks, fix those leaks, and then prevent credentialing disasters. And again, this is if you're whether you're a solo practitioner or managing a multi-site location. So let's be honest. We all know credentialing is not sexy. It's not exciting, but it is something that keeps your revenue going. And the average claim reimbursement delay for credentialing errors is going to be 30 to 90 days. That is if you get paid at all. So depending on your volume, obviously a credentialing mistake can cost your practice tens of thousands or even hundred thousands of dollars easily. So we're going to talk about those 5 mistakes, ways to fix them so that you can make sure that you're not having those issues in your own practice. We're going to count these down from mistake number 5 to mistake number 1. So again, that most dangerous one to avoid at the end. We're going to talk stories, real examples, and really just how to prevent these. Payer contract shows up. You review it, you sign it electronically usually, and you send it back. Then months go by or even years go by. Maybe you had an office manager who took them and organized them somewhere in a file folder that you don't know. Maybe that individual is no longer with you. Maybe you've got credentialing in-house, or maybe it's outsourced and those emails are long gone. Now, obviously, years go by, and if you didn't have copies of those contracts, you didn't have your fee schedule contracts, then you are now left with uncertainty around when you should renegotiate, what you agreed to, and you're trying to dig through emails and file folders, but you can't find it. So obviously, if you don't save your contract, you really struggle to get copies of those later on, and then you are left with a lack of leverage when it comes to verifying things, renegotiating rates, understanding when to renegotiate, all of those things. So when clients come to us saying we're not, getting paid what we expect from, Cigna or whoever, then we obviously first thing we're asking is, okay, give us a fee schedule. And oftentimes practices don't have it. So then we're left with either our team if we do credentialing or their team if they're the ones doing credentialing, chasing down the payer, chasing down the provider rep who can get the copy of the contract, or chasing down a prior employee who may have had those files and trying to find them. So obviously this is not a process you want to go through. That can take weeks. And meanwhile, you are struggling with a credentialing issue that could have been resolved had you had copies of the contracts. So most basic thing, right, is to create, you guys know I love a good Excel spreadsheet, but create an Excel spreadsheet, kind of like a tracker of each individual payer. We have templates of these if you are looking for something. So every single payer, every single physician, every single location, and you put in there, green, yellow, red, what is the status of those contracts so that when were they signed, where the copies of those agreements are. You keep them on a SharePoint or a Dropbox or something that is accessible to your entire practice. It's organized by payer, it's organized by date, and again, it correlates with that tracker so that you have the contract, the fee schedule, the amendment, any sort of, provider contact information, provider rep contact information, that is, so that you have it all crystal clear on if something goes wrong, who to contact, what you need to be doing. So obviously this is something that's so basic, but in the midst of starting a practice, it's probably not the highest on your list. I'm recommending it be put on the high end of your list so that you have that information easily accessible. You can share it with your billing team, and it's easy to create, again, that spreadsheet tracker. So if you are looking for a spreadsheet tracker template, shoot us an email at info@natrevmd.com and we'll shoot one over to you. All right, mistake number 4, not renegotiating contracts when they renew. So payer contracts are often evergreen, right? So that means they auto-renew unless you ask for a change in terms. Now, if you haven't renegotiated in 3+ years, you're likely to be due, and you may be able to renegotiate. It's not always successful. Depends on the payer, depends on your subspecialty, depends on the size of your practice, right? So if you're in the very beginning and you're just a solo doc and you've got your contracts, you may not have had much negotiation room, but now maybe you've grown, maybe you have more than one site. And so now it's really time to ask for those negotiated rates to be increased. And it may not be rocket science in terms of how to get that done, right? But it is a process. You got to know when those contracts ended. You got to know who to contact, and you got to create those letters so that you can ask for those renegotiations. Tell them about who you are. Tell them about who you serve, and the size of your practice and how you better improve the patient lives within that payer. And you may have enough to be able to get a 1%, 2% increase, which again isn't a lot, but it does add up. So we have worked with many practices that haven't looked at their payer rates in multiples of years, some 10+ years, they have not renegotiated. And we have seen the credentialing team be able to be successful in asking for that 1%, 2% increase, especially as those practices have grown. They've been able to show, quality metrics and so forth that show that they are a huge value to the payer. So these are very tangible ways for you to renegotiate those rates. So again, tracking the renewal windows so that you can set a reminder 90 to 100 days before out, ask for that updated fee schedule, again, using your volume and outcomes as leverage, ask for, pull together your top CPT codes, your top 20 codes, and ask for, 10, 15% increase. You may not get that, but you can try and then negotiate down, obviously taking what you can, but, if you don't ask, you're never going to get any additional revenue. So mistake number 3, waiting too long to credential a new provider. I think when it comes to hiring new providers, new physicians, new mid-levels, whatever the role is, you've got to really take into account that credentialing takes time, right? 60 to 120 days. 60 is probably being really generous these days, probably closer to 90. And that, of course, depends on the payer. But many practices wait until the provider starts to begin credentialing. And so now you're paying a salary. They can't be fully booked, or you're trying to figure out what payers they can see and what payers they can't see. And so really, really important to start credentialing early and have a physician onboarding or provider onboarding checklist so that you can figure out what payers you're going to credential them with, what are those credentialing dates so that then they can start seeing patients. So your office knows who they can see, the billing team knows who they can bill for, and it's all organized. Highly recommend, again, another tracker. You guys know me and my trackers. I love a good tracker. And so really, really important to have a tracker for onboarding and keeping track of who they can see and, what those credential dates are. Sooner the better. Again, as soon as you make that offer, I would start credentialing so that you can make sure that they are in network with as many payers as possible on start dates. Remember, incident to billing can get very tricky with mid-levels when it comes to seeing patients under another physician and billing under another physician's MPI number. There are very specific regulations around this. You can look up incident to guidelines, or certainly we've done some podcasts on that as well. So really, really important to get credentialing done so that you're not having to either write off claims where the patient was seen by somebody who couldn't bill for it, or you're trying to hold claims hoping that they can do retroactive billing, but not everybody does that. And so it gets really tricky to try and submit those claims retroactively. And you may not get paid. So really, really important, get credentialing done as soon as that contract with the new employee is signed. And again, have that new hire credentialing checklist built into your onboarding, and then help provide that to your front desk and to your billing team so that you can communicate clearly on who they're credentialing with. Important to also make sure that you're tracking their CAQH profiles, their state licenses, DEA, malpractice insurance, of course. So all of those things are important to kind of have in that onboarding checklist. If you don't already have one, really, really important to create something like this for your practice. Now, quick eligibility plug-in here, right? So If your front desk is struggling with denials related to eligibility and they're struggling with, insurance verification in general, then check out the link below in the show notes for an eligibility training for your front desk. It is truly the number one issue that we see in practices, and it is possible to get this right, but you have to have a solid process with training and education for your front desk staff so that they have a solid process when it comes to insurance verification, patient collection of fees up front so that you aren't leaving money on the table. So head on to the link below in the show notes to check out our eligibility training guide. All right, 2 more mistakes to go for credentialing. So mistake number 2, not knowing which plans you're actually in network with. So you think you're in network with Aetna or Blue Cross, but you're not in network with all of their subplans. Really, really important for you to understand. Again, it goes back to that credentialing tracker, that you have an understanding of what payers you're in network with, what plans that you're covered with. One, so your front desk, back to eligibility, can go and check that the patient has the plan that you're in network with, and then you can, make sure that, you are giving the right information to patients and that they know that they're covered, or if they're not covered, that they're being seen as a self-pay patient, because you have to have that conversation ahead of time. Because once those claims get denied, then it's going to be a really big challenge to get those self-pay fees paid, and also just, makes the whole process feel clunky, plus a delay in revenue. So obviously making sure that, you know who you're credentialed with, you know what plans, that you have this in an easy format, one, so you can share with billing companies or your front desk staff, or with a new provider onboarding, you can make sure that all of those credentialing applications are submitted and tracked. So, obviously we see this happen where, a patient was seen, they had United Healthcare, but the actual plan was a community plan. And so they had denials that happened. And so that lost in revenue, patients are angry. They thought they were covered. They're not covered, and they didn't expect a self-pay fee. And therefore, in reality, you, depending on your financial contract with the patients, may not have any ability to even charge them that self-pay rate. So upset patient, upset front office, lost revenue. It's just frustrating for everybody. So having, again, that tracker of who I'm credentialed with, what plans those are, saving those contracts, saving those fee schedules, will just help everything run much more smoothly in the office. So obviously, all right, let's talk the last mistake. Not tracking credentialing expirations or re-credentialing. So obviously credentialing is not a one and done process. Licenses expire, CAQHs need updating, and payers require this every few years. Really, really, really important that someone is monitoring this and looking at those notifications. You will get an email about these things, but make sure it's an email box that is looked at and that somebody is actually addressing them. We have seen these get missed, and physicians get terminated, and then getting them re-credentialed could be months. And then you're left with managing patients who you're now having to see, telling them that they're now out of network and they have an option of self-pay, or trying to reschedule them with a different physician in the group. Huge nightmare. Very, very painful for everybody. So we have certainly seen this happen before, where there was a missed CAQH update and the payer actually did terminate the physician. So really, this is also something you may not find out until the claims start getting denied. And so because of that re-credentialing process, you can lose tens of thousands of dollars related to denied claims, and just upset patients and upset physicians, right? I mean, again, these are not things we went to medical school with. They're annoying. It's a pain. But having somebody who is assigned to, periodically looking at the credentialing calendar, looking at your payer contracts, looking at licenses, CAQH attestations, malpractice coverage as well. Really, all of these things that have to be managed in order to make sure that you stay in network with your payers is really, really important. So like I said, bonus tip here is really just adding that quarterly credentialing review to your operations checklist. So office manager, they are looking at the tracker. They're seeing what contracts may be up for renewal. They're looking into CAQH licenses, malpractice, et cetera, and just making sure everything is buttoned up so that you don't get into a situation of denied claims. Obviously, denied claims, You guys know we put them onto a tracker. We work with the practice to get to that root cause. So we're calling out those credentialing issues. But we know that some billing companies, they don't communicate that information, or they communicate via email. The email gets lost. Really, really important that these things are stayed on top of. So bottom line, credentialing is just one of those areas where the cost of neglecting these to-do lists can be massive for a practice. And the fix is often pretty simple. It's annoying, right? Because it's another spreadsheet, it's another tracker. And I know you guys are focused on patient growth and seeing patients and taking care of patients. And then, of course, managing and building your own team. But credentialing does end up being one of the things that gets sometimes neglected. And so really important to take these 5 mistakes, take them into heart, set up these processes. And of course, if you are looking for a new billing or credentialing team, head over to natrevmd.com. That's natrevmd.com. All right, so we'll do a quick recap, right? So we'll talk about those 5 things. Number 1, save your contracts, fee schedules. Make sure that you have a tracker that lists, all of the payers and the plans that you're in network with, and the due dates and which physicians are in network, basically listing it by facility and by by provider. And number 2, renegotiate your contracts, when they're up for renewal. Sometimes it's 1 year, most often it's 3+ years. Those auto renewals aren't going to be letting you know that it's time. They're going to just auto renewal. So you'll want to make sure that you are proactive when it comes to reaching out to provider relations, asking and submitting documentation for a renegotiation. Number 3, delaying credentialing for new hires. Number 1 cause of preventable revenue loss when you are hiring for folks. So making sure that you're starting credentialing early, you've got a provider or physician onboarding checklist, and you're getting organized when it comes to getting those things completed for them to start. It's also a really good way for you to communicate to your billing team, communicate to your front office staff on who they're credentialed with and who they can see up until the time that all credentialing is complete. Obviously, number 4, knowing what plans you're actually in network with. Huge thing for both you to know and also for your front desk staff to know, so that you don't have billing disasters and denials and unhappy patients on the back end. And last, not tracking credentialing expirations or updates kind of goes back to number 1, right? But you'll want to make sure that you are tracking the CAQHs, updates and attestations, licenses, malpractice, all of that, so you don't actually get terminated without warning. We've seen it happen. It is rare, but it can happen, and it's a huge issue, and it's just a pain in the rear end. So obviously, these things are all avoidable. So if you're tracking the right details and have the right system in place, you're going to be successful. So, check this out, send it over to your office manager so that they can take a listen. And obviously, if this episode was helpful, we would love for you to share it with a friend. All right, talk to you later.